morning. I would like to acknowledge the traditional custodians of the Wurundjeri Woi-wurrung people of the lands I am speaking today. I also acknowledge the traditional custodians of the lands on which you are living, learning and working from today, and extend that to our Aboriginal and Torres Strait Islander colleagues who are here today. As we share our knowledge, teachings and learnings, may we also pay respect to our elders, both past and present, as it is their knowledge and experiences that hold the key to success of future generations. I'd now like to introduce Fiona Lawton.
Thank you, Shannon. Good morning and good morning, everybody. I'm joining you today from Kondamuka country in southeast Queensland. Fortunately, the sun is shining for us and hopefully things will dry out pretty soon. I'd like to acknowledge the elders of the Kondamuka country and pay my respects to elders past and present. This morning, I have the privilege to introduce a wonderful person who is a strong advocate for people with rare disease and makes an outstanding contribution. I will be introducing to you Mr. Trent Zimmerman, who's the member for North Sydney, and I do so in my capacity as the president of the Angelman Syndrome Association of Australia. Angelman syndrome is a very rare neurodevelopmental genetic condition affecting about 1 in 15,000 live births in Australia, and is growing in terms of recognition and awareness because of the great advocacy that our community and the rare diseases community more broadly bring to the table. And so it's the patient voice, as we heard yesterday from the wonderful program developed, put together by Kate Holliday, that the voice of the patient organisation is critical and essential in defining our healthcare system and the future policy direction and healthcare outcomes for all people with medical and health conditions. So the person who really doesn't need an introduction will get one anyway. So Trent Zimmerman, as I said, is the member for North Sydney in the Australian Parliament. A very, very busy person who sits on a standing committee for environment and energy, standing committee for communications and the arts, and the House Privileges Committee. Convener as a coalition for Friends of Tourism, co-convener of several bipartisan parliamentary friendship groups, including rare diseases. But probably best known in this panel for being the chair of the House of Representatives Standing Committee on Health, Aged Care and Sport. That committee, having released last year in November 2021, the Sentinel Report, the New Frontier Delivering Better Health for All Australians, also known as the Zimmerman Report. So I know we're going to hear some wonderful insights and learnings from Trent in terms of the role that he plays and his relationship with rare disease groups in particular, which make up the majority of the National Patient Organisation Network. Good morning, Trent.
Good morning, and thank you for having me. And it is a pleasure to be joining this morning, in my case from Parliament House in Canberra today, and I want to acknowledge the Ngunnawal and Ngambri people and pay my respects to their elders past and present. And thank you for waking me up with a bit of Hunters and Collectors. I'm glad the video wasn't on because you would have seen some very poor bopping, although not as bad as yesterday when I was at a restaurant opening and they had a K-pop band, and I was caught doing a little bit of a routine in the back of the restaurant, which thankfully wasn't on video. Look, it is a great pleasure to join you this morning, and it was wonderful in that video presentation at the beginning to see so many of the constituent organisations that you have that are ones that I've had the great pleasure of working with over the last couple of years, particularly in my role as co-chair of the Parliamentary Friends of Rare Diseases, but also as chair of the Parliament's Health Committee. And I want to give a shout out to three, and always difficult doing that, but can I start with the Mito Foundation for their incredible advocacy and work during the last 12 months, which has led to what has been a significant debate in the Parliament, and is a great credit to the work that they have done to elevate the important, ethically challenging in some ways, but not really, in my view, but the important new technologies that are coming down the line. I also want to acknowledge Epilepsy Action Australia, because before I was in Parliament, I was actually on the board of Epilepsy Action Australia for a while. I've seen their great work. And finally, from a very personal point of view, I also wanted to acknowledge Crohn's and Colitis Australia as someone who suffers from Crohn's disease. I have seen a little bit of their work supporting people, thankfully in my case, mild Crohn's, but I have seen their important work in supporting people with Crohn's disease. And finally, of course, we're coming the day after World Rare Disease Day, so it has been an important opportunity to reflect on the 3 goals of Rare Disease Day of improving diagnosis, treatment and support for rare diseases. And that really is the segue into everything that my work as chair of the Health Committee has been all about. That is trying to ensure that we are providing better diagnosis, treatment and support for people in Australia suffering from a range of conditions. I always think it is important to acknowledge where Australia is strong, and I think that our health system in this country is world leading. The Medicare system, I think, is one of the best in the world. I think that the pharmaceutical benefit scheme is one of the most important in the world. And I think the quality of those working in the healthcare system is truly world leading. And over the last 2 years during this pandemic, I think Australians have developed a great appreciation of that. I think the heroes of the last 2 years have been all of those in our health systems, be they those on the front line, our nurses and doctors and our pharmacists. The role of pharmacists, I think, has been more greatly recognised as a result of their work, through to our medical researchers and scientists who have just been doing groundbreaking stuff. And to this day, I still lament the fact that we got so close with that University of Queensland vaccine for COVID, but unfortunately was knocked out at the time, and I know they're still doing work, but got so close to developing a homegrown vaccine for COVID. And I also want to mention, because sometimes we don't, the health bureaucrats that worked during COVID and that I've worked with closely in a range of capacities through the Health Committee, because really the work they've done, often 24 hours a day, be it the TGA, be it state and federal health bureaucracies, has just been so extraordinary. But that appreciation of the healthcare system over the last 2 years, I think, has also given us an appreciation of the opportunities that lie ahead of us, not just for COVID management and treatment, but across so many areas. And last year, as you know, my committee completed what was a long and probably a bit bigger report than we initially anticipated when we embarked on it. Basically looking at ways in which we can ensure that the Australian health system, while good, can be even better. And that inquiry, by way of background, for me emerged from the work I'd done with the rare disease community, with so many other health organisations and patient organisations, but also from some of our earlier inquiries, because there were some common themes that emerged from those as we put a spotlight on some of the areas, some of the conditions in the health that affect Australians' health that we thought needed that spotlight. And really, this inquiry was an opportunity for us to bring in a holistic way all of those themes together, because what we wanted to do was to make sure that effectively our health system was ready for the next wave of technology, which is already coming down the pipeline, and making sure that Australians were at the front of the queue and not the back of the queue, or somewhere in the middle, more likely. So at the heart of what we've done, and we made that very clear from up front, amongst all the stakeholders that were involved, was made clear that our goal was to make sure that patients were getting a better deal. And that's what this health system has to be about. I'm always reminded of that great Yes, Prime Minister episode, where the Prime Minister visits a hospital that's been given an award for the most efficient hospital in Great Britain. The only problem is that it has no patients, which is why it was so efficient. And it's a reminder of the fact that you can have a great healthcare system in so many levels, but unless you're supporting patients, then it's all pretty meaningless. So I know that a lot of you are familiar with the work of the inquiry, and I don't want to recap every recommendation we made and every finding that we made. But I do want to touch on a couple of key themes. Firstly, I do think that there is more work to be done to make sure that our health system, our reimbursement system particularly, is able to cope with the new wave of therapies and treatments, be they technology or more likely in some cases gene therapies and cell therapies and so on that are coming down the pipeline. And so that's why a lot of our work was looking at ways in which we can ensure that that early access is happening. And at the heart of that was our recommendation to establish a new national office for rare diseases and precision health to basically try and make sure that within government, at the national level, there is a body within government, not independent of government, but within government that is really driving the knowledge base, the support for patients, the education role, but also being effectively an advocate for changes that will need to be made to cope with some of those new therapies and technologies. But secondly, flying from that, one of I think our key recommendations was the recognition that we needed a new HTA pathway for things like genetic therapies, for therapies that under the current system are testing the silos that exist and where improvements can be made. But the other areas I was really proud of that we're able to make recommendations in were things like ensuring that there is a better process to the life-saving drugs program, so it doesn't have to go through the two-step longer process, so that we have a single stream. Things like making access for orphan drugs a lot easier. The newborn screening program, standardising that across the country, but also making sure that it's meeting the current needs of Australians in relation to what we include in the newborn screening program. And the list goes on and on and on. But the one thing I did want to talk about a little bit was the role of the patient in that process and the organisations that many of you represent here today. And we had a number of recommendations dealing with that, but basically the core of that was that all of government systems need to be making sure that firstly, patients are involved from the get-go, and secondly, that they are being resourced to participate in what can be a complicated and difficult process. And two things I wanted to mention was the fact that we recommended that there be more support for particularly small patient organisations, more likely to be rare diseases, that can find the system a bit hard to navigate. But secondly, also even providing greater resources, financial resources for patients to actually be sponsoring new drugs through the system where there isn't a sponsor company to do that. Now, I could talk all morning about the report and about some of our findings, but I just wanted to conclude with one important message, and that is that in every inquiry I've conducted as chair of the Health Committee, the most powerful testimony, the most powerful advocacy, the most persuasive advocacy has come from patient organisations. Often that's been testimony that's reduced our committee to tears. And time after time, in particular, we have just been so impressed with the role and the love and the care being given by parents as they cope with particularly rare diseases, but more broadly in their children. And that has been exceptionally powerful. And all of you do an amazing job. I know that for many of you, it's running organisations off the kitchen table on the smell of an oily rag. Some of you have better fundraising capacity through greater history or larger populations or greater public awareness, but be you small or large, never underestimate the role that you're playing and the success that you're having. You should be very proud of what you're doing, and I certainly have valued more than anything else during my time in Parliament the opportunity to work with so many of you. So thank you for having me here today, and going forward, it will remain my mission to be a strong voice within the Parliament, within the parliamentary party, but also in a bipartisan way. And I should conclude on that note. Our report, perhaps unusually, like every other report our committee has done, has been a bipartisan, unanimously adopted report, and that is just so important. And I conclude by thanking you, but also people like Dr. Mike Freelander, my deputy chair, who's made that possible. And hopefully together we can make a difference and make everything that we celebrated yesterday or recognised yesterday on rare diseases today in terms of what our goals are reality for Australians as we head into the future. So thank you for having me this morning.
Wonderful, Trent, and of course there's lots of recognition from the community coming through on the chat about the great work that you do and the leadership that you bring to the committee as well too. And it is no small feat to have such a great bipartisan support. And we heard yesterday about the fact that we can challenge respectfully and persistently with government, because it is in fact our health system, and of course we're very close to what it means to have a high functioning and sustainable and innovative healthcare system. And of course there was much excitement about the Centre for Precision Medicine and Rare Diseases being within government, as you say, recognising the fact that we want to be able to work with government, but also having a very, very strong voice within government is critical. Also, what was very comforting for a number of these groups that are here today is the fact that there's recognition that that there need to be resources for the mums and dads, for the volunteer organisations, for those that don't have that capacity or be able to understand some of the complication in terms of bringing things to government and bringing things to trial as well too. So it's great that it's not all just about big pharma, and it's not just about well-funded and well-resourced groups, but recognising the fact that we need to bring the voice of all of the Australians who need some of the support, particularly in that rare diseases space as well too. I think we've just got a couple of minutes just for some questions, if there are any coming through. So I think everyone's just in awe of the report, the work, and your commitment. So, I mean, obviously, we were talking yesterday and challenging, I guess, some of the speakers, saying what would our healthcare system look like without patient organisations and patient network? What would your role look like if we didn't exist and we couldn't bring that testimony and that voice to the table?
Well, it might be a strange analogy, but it'd be like a company trying to sell a product without thinking about its customers. As simple as that. It's really got to be the core of what the health system's about. And I think that the fact that and obviously in a civil society, one of the challenges is that there will be some that are better organised than others. There will be some that are better resourced than others. It will never be a perfectly equal playing field in that regard. And government can't change that entirely, but what we can do is assist to try and level it a bit so that every voice can be heard and has the capacity to participate in the system. But without the patient organisations that are represented here today and more broadly, I just don't see how you consolidate those voices in bringing the message to government that you need to. And that's why they are so important, because each organisation represents, well, I mean, if you look at health conditions affecting Australians, look at rare diseases alone, 2 million Australians. So, but scattered across 7,000 diseases. So the role of those organisations in being able to represent particularly small cohorts of people, I think is just so crucial. And that happens obviously at the individual level through work like yours, or through collectives like this, or Rare Voices, or other organisations like that. So it's just hard to fathom that we could provide the support that we do and need to continue to do without the work of with patient organisations.
And there's one question. Obviously, we're in an election mode now, coming up with the federal election, and from the question from the Leukemia Foundation around what commitment there will be in the next Parliament to implement the recommendations of the New Frontier report.
Well, I think we should just rename the report Coalition Election Policy and hope the Labor Party does the same. But look, I mean, I have to say that one of the things, and I'm not quite sure what the timing of the government's formal response will be, and there's obviously other processes overlaying it, for example, that which emerged from the agreement with Medicines Australia. But what is pleasing is not only is the report bipartisan, and I've never had this reaction where basically on the same day, the minister and the shadow minister come to me and say, this is one of the most significant contributions they've ever seen from a committee. So having that initial buy-in, and the feedback I've had is also that there is strong buy-in from the department itself, which is often the starting point for the drive for change. Can also play an opposite role if it saw fit. So it is very important. So the fact that you got that buy-in, I think, is really important. But I do like to think, without sounding too precious about it, I do actually like to think that this is really the blueprint or the roadmap that the government can take forward in the next parliament. Some things that can frankly be done straight away, in my view. And one of the interesting things about the Health Committee is there's a lot of committee reports in Parliament end up collecting dust on shelves. For a lot of our reports that we've felt strongly about, we've revisited them 12 months on, 2 years on, and I'm keen to do that so that basically we keep the pressure on the department and the government of the day by effectively reviewing the review and seeing what's happening with the recommendations that we've made. So I think there are mechanisms for us to be able to do that as well.
I think it's probably fair to say that it's not just a blueprint for the government, but it also provides that roadmap for our organisations as well to also amplify our voice, but also hold government accountable to deliver what is logical and necessary and for many in the community essential for the health outcomes for the future. So that's wonderful. We promise to continue to keep coming back and raising these matters with government as well too. So we understand how very busy you are. We understand and very grateful for the time that you've given us today, and not just what you do, but how you do it, and the way that you bring the compassion and the voice and just that genuine care for our rare disease community and more broadly for our patient organisations. So please continue to do this fine work, and we're very, very grateful that you were able to join us today.
Thank you. Thank you for having me, and good luck with the rest of the conference.